Good evening, everyone, and welcome to OET Listening Prowess. This is me, Shaji, joining you from 𝐀𝐮𝐠𝐬𝐭 Academy. Yes, we've come with yet another OET Listening Live. How are you all doing? I hope you're all doing great. You're all practicing your listening and you're all preparing for your exams, okay? And I've seen it in the previous lives when I see your responses, when I see the way you answer, when I see your dedication in sitting and watching the whole live, I can understand how much you're ready to invest your time into learning something new, and how much you're working really, how much effort you're actually putting in and to get good scores, good grades. Okay. And I hope you've already come to know about us, the 𝐀𝐮𝐬𝐭 Academy, starting off our offline batches from this August 5th. So if you want to know more details about it, you can contact us in the number provided in the comment box. So we are starting off offline batches for IELTS, OET, PT, and German. And can't wait to see you all in person. So I hope to see you all there. So now we'll begin today's live, and let me see who will have joined. Good evening, everyone, once again. Yes. So you know that in OET listening, we have 3 parts: Part A, Part B, and Part C. In our OET listening prowess, what we do is each day, like each live, what we do is we take one section. In one live, we'll be doing Part A, Extract 1. In another live, we'll be
questions
doing
31
Part
to
A,
42.
Extract 2.
In this part
In
of the
next
test,
one, we'll be
you'll
doing
hear 2
Part
different
B. Part B, we'll be doing the whole part because only 6 questions. Then we'll be doing Part C, Extract 1, and Part C, Extract 2. In the previous live, we did Part B. So obviously, we'll be starting off with Part C, Extract 1. Yes, I have few people joining. 𝐕𝐵, good evening. Dancy Debin, good evening. Binu Yohanan, good evening. Good evening, everyone. I'm so happy to see you all here. So, yes. So, how are you all doing? I hope you're all doing great. And okay, coming back to what we were talking. And today we'll be starting off with Part C. Okay, Part C, Extract 1, we'll be covering today. 6 questions. So, when you do these 6 questions, optimum score should be 4. You should get a minimum of 4. Okay, that means 4, 5, 6. Those are the good grades. Okay, those are the good scores. Okay, so you should try to score that. And when you're doing just Part C, Extract 1 alone, I would expect you to get around 5 or 6, okay? That's what I will expect. And in Part C, what all things do you have to be careful about? You know that we have interviews and presentations. If it is an interview, we could be really happy about it, because why? When the interviewer asks us the question, we'll know, okay, he is going to ask us a question about question number 31. Okay, the interviewer asking when and then he'll be talking about it. After that, when he moves on to the next question, you can know that, okay, he's moving on to question number 32. When the interviewee or the person, the guest will be answering that. And when the interviewer moves on to the 3rd question, you'll know that they're moving on to question number 33. That is easy to identify. But if it is a presentation, you have to look for signposting. What is signposting language? They will be using certain words and phrases. For example, they'll be saying, so now, so maybe imagine they're talking about pain in general, and then when they have to move on to the next part, they'll be like, okay, now we'll talk about swelling. So they'll use some words like that to indicate that they're moving on to the next topic. So you have to look for those things and you have to follow that. All right. Yes, Salmia Babin, good evening. Bhavya Sharath, good evening. I'm so happy to see some new faces here. Like I always say, I say faces because I have this feeling that I'm seeing you all in person. Okay, so I'm very happy to see you all here in the comments. And to talk about certain like tips, or to give you some tips on your OET listening Part C, I would say when the 90 seconds time is given, you have to read the questions carefully. Reading your questions and understanding the questions is very important. So when I tell this to students, what they say is, okay, I'm reading the questions or I'm trying to understand it, but I'm not able to finish reading the questions. One of the major problems I've seen with students is that they make lip movements while they're reading during the 90 seconds. So in part C, unlike part B, you're given 90 seconds to read the whole extract. That means you'll be given 90 seconds to read question number 31 to 36. I hope you guys know about this. I'm telling this basic things. I'm giving you this basic idea for students, those who have joined, those who are freshers. Okay, so I see some new names here. So for those students, I'm giving this information, that in order to read all the 6 questions, you will be given 90 seconds, and during that 90 seconds you should finish reading the questions and the options. Sometimes it is very challenging for you. It is very challenging in the sense you won't finish reading it within the time, or if you try to finish reading those 6 questions within that time, you may not be understanding what is written there. For that, you have to work on your reading speed. One thing you have to avoid is making lip movements while reading. That means, for example, if I'm reading this question, I'll be like reading, okay, extract 1 questions 21 to 36 of 90 seconds to, you see my lips are moving. So I would say I'm reading in mind, but I'm actually reading it out loud. So that would take the same amount of time you would take to, or maybe a little less than the time that you would take to read out the questions. But what you have to do is read in your mind. When you're reading it in your mind, your speed will automatically improve. And focus. Focus is very important. When you're doing one whole practice, so here you're only doing 6 questions, but when you do a complete material, what happens is that by the time you reach your part C, you lose your attention, your focus, your concentration, when that is the place where you have to have the greatest focus, and that is the place where you have to be concentrating the most and focusing the most. So when that is the case, what you have to do is you should practice more. You should do your script writing more and more often. Not more and more often, I would say every day. So you should have a discipline. You should have a plan about what you will be doing every day. Every day I will be spending this much time on this, or more than keeping it upon time or deciding things, dividing things on the basis of time. I would say you should also have a plan of what you will do. Okay, in classes and all, we'll be covering one single portion. So make sure you have complete idea about that portion. So you might wonder, why should I be investing a lot of time in part C, extract 1? Okay, imagine you're doing this material today. So when you do it, you should have complete idea about it, by complete idea, what I mean is you should know there shouldn't be any word or any phrase that you don't know the meaning of. You should be knowing the meaning of all the words in it. You should have complete understanding of the material. So you will ask me, what is the point in knowing all the words in that material, or having complete understanding about that material, when we're not going to get the same material for exam? Yes, you're right. You're not going to get the same material that you're practicing. You may get it, most of the time you will not get it. So when that is the case, why are we stressing on you knowing that material very well? Why are we asking you to practice that material once again? Why are we asking you to do script writing with it? Why are we asking you to do that material again, and so that you get full marks in it, so that you have complete understanding about it? Because if you're able to do a material really well, that means there you're improving your vocabulary, you're learning new words there, you're learning new sounds there. You're able to understand certain sounds. Okay, when one particular word is pronounced this way, it is not that word. Okay, I heard this word as this, but this is actually this word. You're learning those sounds, okay? That knowledge will definitely help you in your next material, and you will see some changes there. All right, and okay, so 𝐿𝐺𝐿𝐺𝐿 is asking me how many material we'll do daily. Okay, that is a good question. So by material, if you mean part A, part B, part C audio, I would say if you're attending a class or something, in the class you will be doing one material. Imagine you're doing, depending on the level. If you are in an advanced level, you will be doing one whole material, okay, or difficult material. But if you are a base level student who is just starting off with all of these things, you will be doing maybe just part A alone, or you will be doing your part B alone or part C alone. So depending on your level, you will be doing something in the class. So if I were to tell you what you have to do, when you go back home, whatever you learned in the class, if it is part A alone, okay, if you are just starting off, I hope Liji is just starting off, or I don't know, I'm not making any random guesses or assumptions, but if you are, I'll talk about both students who are just starting off and students who are having the advanced students who are in the advanced level. So by advanced level, what I mean is like students who have had a few months of experience with OET listening or few weeks of experience with OET listening. So if you are a beginner, okay, like I said, you will be learning part A or part B or part C, whatever that is. If it is your day 1 class, what you will do, you will go to your class, you will do the material in the class. When you're back home or right after the class, you will try that material once again, okay, that material once again. Then you will do script writing for that material. That is enough. On day 1, that is enough. On day 2, day 3 also, that will be fine. When you move to day 4, day 5, day 6 and all, again you will be doing your part B or part C or things like that. Whatever you are learning in the class, you're going to practice that material. If it is part A, part B alone, just do part B alone. Okay, if it is part C alone, you will be practicing that material again, and you will be writing, you will be doing your script writing. Done. Very good. Okay, and in between, by the 4th class onwards, you can go for the videos. Those are recommended by OET themselves, like GPs behind closed doors, CSA videos. These are all the videos recommended by OET themselves. So you can go through those videos and listen to those things when you get free time, and you can do micro listening. I've explained micro listening in the previous lives. If you want me to explain it, I will explain it once again. You can let me know in the comments. So, okay, you can do all those things in between. Okay, and when you are done with almost your part A, part B, part C exclusive practice, and when you're moving on to your full material practice, and now you are an advanced level student who is doing full material practice every day, and your exams are far approaching, what you will do is, your exams is soon approaching. So what you will do is, you will take this full material practice, this full material, by full material, what I mean is part A, part B and part C. You will take the whole material, you will practice it again. See, by practicing it again, if you are doing, I won't say you need to do more than 1 material every day. 1 material minimum. If you are an advanced level student also, minimum 1 material, maximum 2 materials. Don't do more than that. You know why? You need time to practice your other sub tests as well. And if you set unrealistic goals, things are not going to work. Okay, so make sure you're spending ample time with it. Minimum 1 material you have to do. So if you are, so to Liju, what I'm saying is, if you are an advanced level student, practice at least 1 material every day. Practice the same material again. Then do its script writing. Then you are all good to go. Okay, so what we mean is you're investing time. It's not about the number of materials you're practicing. It is all about the quality time you're spending with the material. That is important. If you're not learning anything new from it, there is no point in you trying a material. Okay, you have to invest. And if you are a student who is not going for any classes or anything, if you are preparing on your own, what you can do is, like I told you, for the first 5 class, focus on your part A, then part B, then part C, then start with the whole material. Take it little by little, okay? 1 by 1, you do it and you will be all good to go. So I hope that answers your question. It was a long explanation because when you ask a question, it wouldn't be just answered to Liji, but I'll be answering it to all the students who are watching. So I should be considering students who are beginners and also students who are in their advanced level. Okay, so what they can do during their practice. Okay, very good. So now what I can tell you is, so this is how your practice should go. Okay, no matter what, It is all about the quality time you spend, the quality. Trust me, I'm telling you, because I had a student in my class. This happened today, so I was talking to her, and she was telling me she only got 1 mark. So I was like, what happened? What happened? That was my question. And she said she was not able to practice the materials that I gave her. She was not able to do the things I asked her to do yesterday because of some personal problems. You see, she is in the class right now. So if you ask her, did you go to class? She would say yes. But even in the class, she is somewhere else. She is not able to concentrate. She is not focusing. In between, when I ask her questions, she was like, could you repeat it? Then I'll answer, because she is not focusing. So there she is actually spending 1 hour, but no point in spending 1 hour like that. Why? Because if you do, it is not about the number of hours you spend. It's not about the number of materials you practiced. It is all about how much effort you have put. Like, how many quality hours did you spend? How many materials did you practice with at most dedication and attention and focus? That is important. Even today's material, oh, Liji is saying thank you with a lot of hearts. Thank you. Oh, it's a pleasure answering your questions. So we have 6 questions today. So I'll tell you, take it one by one, okay? Now you're doing this part. Just focus on this, okay? Sometimes when I give the students materials, they'll be asking, where can we get extra materials? And I'm like, focus on this first. Okay, that question is valid. I answer them that question. But right now, what I want you to all do is focus on these 6 questions I'll be showing. Try to get 6 out of 6. That should be your aim. This is not a very difficult material, but this is like a somewhat medium level. That is the difficulty of this material. Not very easy. I wouldn't say it's very easy, and I wouldn't say it's very tough. It's an okay type of material. So this is definitely going to help you. There are a few new words in this, and if you don't understand those words, you may make mistakes in the answers. So in the audio script that I've provided, I've also given the meaning of that. So if you don't know the meaning of such words, don't worry, all those words will be discussed in the class, okay? I mean in the live. So what I'll do now, those of you who've watched our lives before know the drill. What we do is we play the audio first, and the questions will be displayed on the screen. You will write the answers, and after that we'll be giving you some time to take the screenshot of the questions or to copy down the questions, so that when we discuss the answers, you have those things handy with you, and you will be able to cross-check, and you'll be able to have a look at it. So now, and then we will be discussing the answers with the help of audio script. I'll be explaining each and every answer with the help of audio script, okay? So now, without wasting much time, let's go to the audio. The audio will be played and the questions will be displayed on the screen now.
Part C, questions 31 to 42. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Now, look at extract 1, questions 31 to 36.
You hear an interview with an optometrist called Henry Chapman, who's talking about the impact of macular degeneration. You now have 90 seconds to read the questions.
We are talking today with Henry Chapman, an optometrist with a special interest in macular degeneration. Mr. Chapman, firstly, what is macular degeneration and how did your particular interest in this disease come about?
Macular degeneration is actually the name given to a group of chronic degenerative retinal eye diseases that cause a distortion or progressive loss of a person's central vision, but leaves the peripheral or side vision intact. Say, if someone with macular degeneration was facing me now, they'd see my arms and legs, the area around me, but my face would likely be obscured by a dark or empty space. They experience a dreadful sense of being disconnected or cut off from everyday life. As an optometrist for 30 years, I've had my share of cases, and every new patient is like a spark because the impact of each accumulates over time to a kind of, almost what you call a fixation, I guess. Even after all these years, however, I was still shocked to hear my sister had recently been diagnosed with macular degeneration, and because of that, I've now also seen firsthand what this terrible disease does to the entire family.
What's the most challenging part for those living with macular degeneration?
Take a recent patient of mine called Robert. He was 55 when he first noticed the symptoms: blurred vision, distortion of straight lines. The effect on his life was profound, and that's the tragedy of this disease. He was working as a driving instructor, then suddenly had to resign, but still with the financial burdens of daily life. His passion for carpentry or even basic reading fell by the wayside. Worst of all for Robert was no longer being able to see his grandchildren's faces clearly, which was obviously very upsetting. Unfortunately, he also experienced depression for a time. This may not happen to everyone, but it's certainly more common than people realize.
What can be done for patients such as Robert?
This is a disease that's typically related to aging, which is the commonest risk factor, but it's certainly not a normal or inevitable consequence of getting old. So although older people are generally more accepting of the extra baggage that comes with aging, it's still difficult for many to accept and discuss the changes associated with macular degeneration. There's a tragedy attached to any disease or illness, but vision loss also carries some major disruptions to a person's lifestyle, as well as mental hurdles, like few other diseases do. I feel that's something that can at times be neglected. There are support groups, but I'm talking on an optometrist level. My job is to help diagnose and treat a patient. But what of their additional struggles? That's where I'd like to place myself a little better, and allow patients like Robert the freedom and availability to open up.
And do patients ever volunteer to express their fears or frustrations to you directly?
They do, but in the beginning what I see is their brave face. They often say, "There's always someone worse off." And that's an admirable trait, but reality soon rears its ugly head. Because macular degeneration doesn't result in total blindness, sufferers are left with partial vision, and I suspect that many patients may genuinely interpret this as being somehow less significant than total blindness, like they don't have the right to speak out. The reality is, of course, that sufferers of macular degeneration have many of the same fears and impediments as those who've completely lost their sight, and yet they're worried about voicing this. So it's imperative that we not only actively listen, but also encourage and support them to openly share their stories.
Can you give us an example of how you've changed the way you treat your own patients?
Sure. I have a patient called Jennifer. She's 62 and has late-stage neovascular or wet macular degeneration. This is caused by the formation of very fragile blood vessels which leak fluid and blood within and under the retina. It also leads to a rapid loss of central vision as opposed to the dry kind, which is a far slower decline. Therefore, it came as a great shock for Jennifer, in turn making her a perfect prototype, if you will, in trying something new. I allocated just an additional 10 minutes to each of her appointments and explained it was for an open discussion. This extra time gave me the opportunity to delve a little deeper into how she was coping with the rapid changes she was experiencing and gave her more freedom to discuss her concerns. The positive change in communication was extraordinary, so I adopted this for all my patients thereafter.
So what, if anything, can be done to help prevent macular degeneration?
Research is ongoing and advancements in treatment are being made daily, and this needs to continue. But you can't leave it up to researchers. I believe in what the individual can do. This means that any difficulty with vision should never be dismissed as part of aging. In its early stages, macular degeneration may not result in noticeable visual symptoms, but it can be detected with an eye test. If people want to save their sight, I can't stress enough how crucial the early detection of any form of macular degeneration is. The sooner that this disease is detected, the earlier that steps can be taken to help slow its progression and save sight through treatment and necessary lifestyle modification.
Try the material. How was it? How were the questions? Were the questions really difficult or manageable? Like I said, it's okay kind of material, not very easy and not very tough. So what kind of a material do you think this is? Yes, now you can see the questions on the, you can see those questions on the screen. You can either take a screenshot of this or copy them down onto a book or a paper. I always recommend copying these questions onto a book so you have them handy with you even the next time you practice it, okay? Yes, 𝐶𝐬𝐬𝐢𝐬𝐬𝐢, good evening. So when I'm going to give you a few seconds to actually take a screenshot of all these questions so that when we discuss, you will be able to have a look at those questions. Okay. Yes, I hope not very easy, a little bit tough. Yes, Reba, that's what I said. It's not very easy. I shouldn't be telling it's very easy, and it's not very tough, a little tough, like okay kind of material. Okay, so let's see. So that means we'll have a lot of things to learn from this. If it is not very easy, that means there are a few things that we need to learn from this. So let's look at the first question. Yes, Shabananas, good evening. What began Henry's special interest in macular degeneration? Option A, seeing the impact it had on his own family. Option B, treating many patients over a 30-year career. Option C, observing the isolation that comes from the disease. So, what made him interested in macular degeneration? Is it having this disease in his family, or treating many patients over a 30-year career, and observing isolation that comes from the disease? What you can see in the audio is they're actually talking about all the three options. Maybe it would be that one word that makes one option the answer and that helps us eliminate the other two options. Let's see how it is done here. So, part C, questions 31 to 42. In this part of the test, you'll hear two extracts. In extract 1, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Now, you already know this, but I'm reading it again so that you wouldn't have to listen to it in the examination hall, or you can read the questions during that time. Now look at extract 1, questions 31 to 36. You hear an interview with an optometrist called Henry Chapman, who is talking about the impact of macular degeneration. You now have 90 seconds to read the questions. Extract 1. We are talking today with Henry Chapman, an optometrist with a special interest in macular degeneration. Interviewer is asking, Mr. Chapman, firstly, what is macular degeneration and how did your particular interest in this disease come about? Henry is saying macular degeneration is actually the name given to a group of chronic degenerative retinal eye diseases that cause a distortion of or progressive loss of a person's central vision but leaves the peripheral or side vision intact. Say, if someone with macular degeneration was facing me now, they'd see my arms and legs, the area around me, but my face would likely be obscured. Obscured means covered by a dark or empty space. So, right, that is a new word that you're learning, obscured. That means covered. Okay, the experience, so here what they're saying, what is this disease, macular degeneration? They're explaining that. After that, they're saying they experience a dreadful sense of being disconnected or cut off from everyday life. This is referring to isolation. So we have an option called observing the isolation from the that comes from the disease, option C. So they feel like they're cut off from everyday life. That means they're experiencing kind of isolation. But are they saying that was the reason what created a special interest in this person, special interest in our Henry Chapman towards macular degeneration? Are they saying that? No, they're just saying these people feel isolated. That's it. So we're eliminating option C. I hope you understood why we're eliminating option C. Those of you who wrote that option, I think it's clear to you. And all of you, make sure you type in your answers in the comments so that I can know how many of you wrote the right answers, how many of you wrote the wrong answers, and if you think even after my explanation you think no, what you wrote is the answer, this is the reason. If you have something like that, you can comment. Okay, be active. As an optometrist for 30 years, I've had my share of cases, and every new patient is like a spark because the impact means the effect or influence of each accumulates over time to a kind of almost what you call a fixation. That means an obsessive interest in or feeling about someone or something, I guess. So he is saying because of the patients he has had over these years, that has created a spark in him. The influence, the effect it has created in him is that he kind of started to feel a kind of fixation. So fixation means a special excessive interest. So this excessive interest, that is the question. What created that interest? That is the patient's over 30-year career. So what is the answer? Option B. Very good, Sandhya Jayakumar, Soumya Pipin, Shabna, Nas, 𝐕𝐵, all of you, very good. Option B is the answer, because if you're writing answer for this, that shows your focus, your attention to the minute details actually. So this is a good job. You should be really proud of this right answer, because you are able to understand even the minute things in an audio. Next, they're saying, even after all these years, however, I was still shocked to hear my sister had recently been diagnosed with macular degeneration. And because of that, I've now also seen firsthand what this terrible disease does to the entire family. So he's saying his sister got this and his family member had it, and this is helping him to see what it is like. He has this first-hand information about what it is to what kind of a terrible disease this is to family. Nowhere he is saying because of this he had special interest, right? We cannot see that. So that's why we're eliminating option A as well. So we eliminated option A, option C, option B is the answer. Very good, guys. Now we're moving on to next question, question number 32. In Henry's opinion, what is the most troubling aspect of the disease? Option A, the inability to recognize the faces of loved ones. So most troubling aspect. Comment your answers. Inability to recognize the faces of loved ones. B, the psychological impact it can often generate. Option C, the changes it causes to a person's daily existence. So what do we have to look for? Most troubling aspect of the disease. Okay, we have to look for the most troubling aspect of the disease. Yes, I have the same people commenting. Soumya Pipin is saying it's C. Sandhya Jayakumar is saying it's C. Okay, let's see. Okay, again in this audio, in this part also, they're talking about all the three options. Okay, so it could be a bit confusing. Interview, what's the most challenging part of living with macular degeneration, or most troubling aspect? So take a recent patient of mine called Robert. He was 55 when he first noticed the symptoms, that is blurred vision, distortion of straight lines. The effect on his life was profound. What do you mean by profound? If you don't know the meaning of profound, you may get this answer wrong. Okay, in the previous question, the word was important, word was fixation. If you don't know what fixation is, maybe you can guess it. But if you have like zero idea about what the word fixation is, there's a chance you may make a mistake with 31. Here, such a word is profound. That means intense. So the effect on his life was intense. So what is the most troubling part? That's the tragedy of this disease. He was working as a driving instructor. The effect on his life was intense. So what is the most troubling part? The effect on life. So option C is saying changes it causes to a person's daily existence. And they're giving an explanation. With that explanation, we can confirm option C is the answer. He was working as a driving instructor and then suddenly had to resign, but still with the financial burdens of life. His passion for carpentry or even basic reading fell by wayside. So what it is, what we can see, the impact, the effect on his life is profound like this. So it is causing changes to a person's daily existence. Oh my gosh, I'm so happy to see these answers. Shabna, Naz, all of you, all those of you who answered, you have correct answers. Others, make sure you're answering the question. Yes, so option C is the answer. It causes change to the changes it causes to a person's daily life. Then we have, they are talking about another part. Worst of all, for Robert was no longer being able to see his grandchildren's faces clearly. So they're saying this is worse, but they're not saying it is the most troubling part. The most troubling part is the effect on his life. That was intense. So option C is the answer. Their option A is saying inability to recognize loved ones' faces. That is there, but is not the most troubling part. And they're not mentioning that as the most troubling part, which is obviously very upsetting. Unfortunately, he also experienced depression. He also had depression, but they're not, that is psychological impact it is creating, but they're not saying that is the most troubling aspect. That is the thing. They're telling he has all of this, but they're not saying that is the most troubling part of it. Okay, depression for a time. This may not happen to everyone, but it's certainly more common than people realize. So what is the most troubling aspect of this disease? That the changes it causes to a person's daily existence. Option C is the answer. Now let's move on to question number 33. Henry thinks that the traumas associated with the loss of vision are option A, sometimes overlooked with optometric community, often overlooked within the optometric community. Option B, commonly misconceived as part of the aging process. Option C, less understood than with many other diseases. Answer this question. 33, what is the answer? So interviewer is asking, what can be done for patients such as Robert? Henry Chapman is saying this is a disease that's typically related to aging, which is the commonest risk factor. So in option B, they're saying often the traumas associated with the loss of vision are commonly misconceived as part of the aging process. So we cannot say that it is the traumas associated with the loss of vision are commonly misconceived as part of the aging process. It is part of the aging process. It is not a misconception actually. Okay, so they are talking about commonly misconceived as part of the aging process. So this is a disease that's typically related to aging. This is not misconceived. That is, the traumas related to this actually definitely related to aging. Okay, so that means we can eliminate option B, commonly misconceived as part of aging process. What is saying this is misconceived? They're thinking, but okay, they are thinking this is a problem related to aging, where in fact it is not. That is what they're saying in option B. But if you look at the audio, what you can see that it is typically related to aging. So this is a problem related to aging actually. Okay, which is the commonest risk factor. It is a commonest risk factor, so it is not a misconception. So that is why we're eliminating option B. Sandhya Jayakumar, Shabna Nas, understand, because in the audio what are they, in the question what are they saying? It is a misconception, but it is not. It is the fact. In the audio they're saying yes, it is part of aging. What is wrong with it? It is not a misconception. Okay, so option B is eliminated. And Soumya Bibin is saying it is option A. Santhya and Shabana are saying it is option B. So option B is not the right answer. We're eliminating option B. Now what we are seeing is this is a disease that's typically related to aging, which is a commonest risk factor, but it's certainly not a normal or inevitable consequence of getting old. So, although older people are generally more accepting of the extra baggage that comes with aging, it's still difficult for many to accept and discuss the changes associated with macular degeneration. There is a tragedy attached to any disease or illness, but vision loss also carries some major disruptions to a person's lifestyle, as well as mental hurdles like few other diseases too. They're talking about a few other diseases. Look at option C, less understood than with many other diseases. So these traumas are less understood than with many other diseases. That means many other diseases we understand the trauma. Like other diseases we understand there is a trauma, but this one we don't understand, or we understand it less. So we cannot see them talking about such a thing. They're saying this is a tragedy attached to any disease or illness, but vision loss carries some major disruptions to a person's life as well as mental hurdles, like few other diseases do. Just like other disease, this is doing. Nowhere we can see a comparison where that is considered bigger and this is less. So we are eliminating option C, less understood with many other diseases. Then what? I feel that's something that can at times be neglected. There are support groups, but I am talking on an optometrist level. So these things are neglected in the optometrist level. So that definitely matches with option A, sometimes overlooked within the optometric community. So he is saying my job is to help diagnose and treat a patient, but what of their additional struggles? That's where I like to place myself a little better and allow patients like Robert the freedom and availability to open up. Okay, let's move on to next question, question number 34. 34 is saying, Henry believes that macular degeneration patients initially keep their fears to themselves because they, answer this question, option A, are scared to admit they have a serious condition. Option B, do not feel completely comfortable discussing their disease. Option C, consider their disease minor in comparison to total blindness. So when you go to question number 34, what we can see is, interviewer is asking, do patients ever volunteer to express their fears or frustrations to you directly? Henry Chapman is saying they do, but in the beginning, what I see in there is their brave face. They often say there is always someone worse off, and that's an admirable trait. But the reality soon rears its ugly head. What do you mean by reality soon rears its ugly head? Rears its ugly head, meaning typically refers to refers to the way reality emerges or makes itself known, often in surprising or unavoidable manner. For example, the phrase reality rears its ugly head is commonly used to describe situations where unpleasant truths or difficult situations become apparent. It suggests that no matter how much one might try to avoid or deny certain facts, reality will confront them. So these people would say other people have worse are in worse conditions, and then what happens, eventually what happens, their condition comes up. Because macular degeneration does not result in total blindness, sufferers are left with partial vision, and I suspect that many patients may genuinely interpret this as being somehow less significant than total blindness. They consider it as less significant than total blindness, like they don't have the right to speak out. So they fear not to say, they express themselves, say they're confused because they consider their disease minor in comparison to total blindness. Very good. Option C is the correct answer. The reality is, of course, that sufferers of macular degeneration have many of the same fears and impediments, a hindrance or obstruction in doing something. Impediments, okay, that means difficulty in doing something, as those who have completely lost their sight, and yet they're worried about voicing this means voicing their fears. Okay, do not feel completely comfortable discussing their disease. No way we can see that they don't feel completely comfortable discussing their fears. So we're eliminating option B, and we're also eliminating option A because we cannot see them being scared to admit they have a serious condition. They are scared worried about voicing their fears. Okay, they're not scared to admit that this is a serious condition. So it is imperative that we not only actively listen but also encourage and support them to openly share their stories. Now let's quickly look at question number 35. Why did Henry choose his patient called Jennifer to test his new method? Option A, because she had a special kind of macular degeneration. They're talking about this in the audio. Option B, they're saying because of her negative reaction to her condition. Option C, they're saying because her illness was worsening at a fast rate. Okay, if you look at the audio, what you can see is, yes, I'll show you that part. interviewer is asking, can you give us an example of how you've changed the way you treat your own patients? So look at the underlined portion. This person has got a patient called Jennifer. She is 62 and has late stage neovascular or wet macular degeneration. Yes, they are saying she is having a special kind of macular degeneration. But are they saying it is the reason why they chose them? No. So we are eliminating option A. And next underlined portion, so a lot of you were saying C. Let's see if answer is option C. Next part is, it also leads to rapid loss of central vision as opposed to the dry kind, which is far slower decline. So this has got a faster rate of spreading. That is correct. Okay, this is worsening. The illness worsens at a fast rate. That is correct. But that is why you have given me that as the answer. But they are not saying that that is the reason he chose her for this thing. Okay, no way we can see that. He's just saying, okay, this is worsening at fast rate. That is correct. But he's not saying that is the reason why she was chosen. Next part, therefore, it came as a great shock for Jennifer in turn for making a perfect prototype. Therefore, it came as a great shock for Jennifer. This was a great shock to Jennifer, in turn making her a perfect prototype. In turn means as a result, she was made a prototype, an example for everyone else. The first, a prototype generally means the first example of a machine or other industrial product from which all later forms are developed, if you will, in trying something new. So she was selected. Why? Because she was shocked. Okay, that made her a perfect prototype. So it was because of her negative reaction. That prototype means she was selected for it. Sorry. So it was because of her reaction that she was selected for this thing. She was selected for, so all of you, those who wrote option C, that is the wrong answer. Option B is the correct answer. Okay, I hope it is clear to you. Now we are moving on to question number 36. Henry says that preventing macular degeneration is about option A, checking signs of visual impairment immediately, continuing current research into treatment, and beginning with positive changes to one's lifestyle. So what is preventing macular degeneration is about? So if you look at it, what you can see is, so what, if anything, can be done to help prevent macular degeneration? Henry Chapman is saying research is ongoing and advancements in treatment are being made daily, and this needs to continue. He's just saying this needs to continue. But preventing this is not about this. Okay, that needs to continue. He's nowhere saying this is good for prevention. No. What he's saying is, but you can't leave it up to researchers. I believe in what the individual can do. This means that any difficulty with vision should never be dismissed as part of aging. In its early stages, macular. So in early stages itself, we should go check our vision. Early stages of this degeneration or vision problem. In its early stages, macular degeneration may not result in noticeable visual symptoms, but it can be detected with an eye test. That means you should go for an eye test. If people want to save their sight, I can't stress enough. If people want to save their eyesight, that means prevention method. Okay, if you want to keep yourself away from this illness, if you want to save your sight, that is the prevention method he's saying. I can't stress enough. I can't stress enough how crucial the early detection of any form of macular degeneration is. So if you want to prevent, if you want to save your sight, what do you have to do? You have to detect, early detection is important. So that matches with option A. Option A is the answer. Okay, so you're all saying option C for 36, beginning positive changes in one's lifestyle. So here is the answer. Option A is the answer. Checking signs of visual impairment immediately. See, look at that part. If people want to save their sight, in the yellow part, second last line. If people want to save their sight, I can't stress enough. If they want to save, if they want to prevent their eyesight from lose, if they have to prevent this macular degeneration, they have to what? I can't stress enough. That is very important that they go for an early detection. So that means option A, checking signs of visual impairment immediately. And I have some of you saying, continuing current research into treatment, we eliminated that option. He's not saying that is for prevention. He's saying it's good. Okay, do it. He's not saying it is for prevention. So we're eliminating that option. Then they are saying, beginning with option C, they're saying, beginning with positive changes to one's lifestyle. Yes, a lot of you have given option C as the answer. Look at this sentence, last sentence. The sooner that the disease is detected, the earlier steps that can be taken to help to slow its progression and save sight through treatment and necessary life modification. So once it is detected, okay, that is after detection, you can make some changes to lifestyle. That is what they're saying, not to prevent it. Okay, once it is detected, earlier steps can be taken to help slow its progression. So you have it. It is not prevention method. Like you already have it. So now you're treating it. You can reduce its progression, save the sight through treatment and necessary lifestyle modification. So once you get it, once you detect it, this is what you can do to save your eyesight. The other one was if you want to save their sight. That means if you want to prevent it from coming, you have to go for early detection. So option A is your answer, and option C is also eliminated because of this. By this, we're done with all the 6 questions. Now I'll show you those questions on the screen once again with the answers marked on it. So for exam, those circles have to be darkened. 31B, 32C, 33A, 34C, 35B, 36A. So I hope this was helpful for all of you, and I hope you learned some new words. If you couldn't note them down, make sure you watch this again and note those words down and their meaning and learn it. And if some questions are not clear to you, you can listen to this again and try to understand these questions and make sure you understand why those options became the answers. Okay, we'll come again with yet another OET listening prowess on next Wednesday at 8 p.m. Till then, bye-bye, take care, good night.